Hey guys, this is Robert, physical therapist here at Haymarket PT, and this is Lauren Ciccone. She is one of our past patients that comes in, and during the summer she decided to come back into the office here to get a little bit of work done on her legs because she's trying to return to sport at Christopher Newport.
Yep.
So Christopher Newport University, and I'm going to let Lauren kind of fill you in a little bit about her past medical history, and then we're going to talk about how to decrease knee pain in runners today. Okay.
So in the last 3 years, I've had 2 ACL surgeries, one on my right leg and one on my left. I'm having a little bit of pain above the knee and just feel like I need to work on my stabilization a little bit. So that's why I came back in here to just get really strong and get your opinion.
So, a lot of times when our runners come into the clinic, especially if they had a past injury, they complain about the knee pain, but it's not necessarily that the knee is the issue. So we always go above and below. But mostly with our runners, we always look at the pelvis, lower back, and the core, see what's going on there to try to get tension off the knee. So what I'm going to do is I'm going to have Lauren stand for you guys. I'm going to show you what's kind of going on with her squat right now, and then I'm going to put her on the table. We're going to do like a real quick little treatment just to show you how to get that strength back up, and then we'll go from there. So come on down, Lauren. Okay. So the first thing that you're going to notice here with Lauren's squat, and then I want you to do this about 3 times, Lauren, if you can. Okay, come back up. So when she's squatting down here, she's coming down, and then if you see her knee, it's kind of coming in towards the midline a little bit. Okay, and then go ahead and have a seat real quick, Lauren. So what you're going to start seeing is that there's some weakness here up and through the hip. Okay, and then what that's going to cause is the knee to start deviating more towards the middle because the adductor muscles on the inside are a little bit tighter, a little bit stronger. So Lauren's going to lay back here on the table. So we're going to try to tease that out. We want to try to determine what exactly is causing that. So I'm just going to check her alignment here at the hips a little bit. So go ahead and bend your knees up towards your chest, Lauren. Lift your rear end in the air. Good, back down. Good, bring your knees up towards your chest. Good, all the way out straight here. Good. Good. Okay, so kind of identifying our problem here. So when I lift her leg up here and I muscle test her, hold her right there for me, Lauren. Don't even push it down. Okay.
Wow.
Okay, whenever you're ready, hold it there. Don't even push it down. Okay, so pretty consistent strength both times. Okay, so lift this up here. Don't even push it down. Okay, so as a collegiate runner, to get from this, okay, and to lift this leg up to this, and she had ACL on both sides. So something's going on with her hips and back here that's resulting in her hip to not function the way it should and those muscles to contract. So what we're going to do real quick is a technique that we use here at the clinic to try to get her hip stabilized a little bit more, get that strength firing a little bit more. So basically what we're trying to do is get that pressure off that hose. Now, a couple videos before we talked about, if there's any pressure on the nerve or if there's any pressure on the muscle, you're not going to get that firing, you're not going to get that water coming down out of the hose. So pushing out here, Lauren, we're going to do this 3 times. So she's pushing out as hard as you can. 3, 2, 1, relax. Going to push this out again. Go ahead, we're going to do that 2 more times. 3, 2, 1, and relax. Good, and we're going to push out 1 more time. 3, 2, 1, relax. She's going to come right in. She's going to squeeze under my forearm and relax. We're going to do that 2 more times. Sometimes you might hear a little click. We're trying to do a pubic symphysis release in the front here. Trying to get her pelvis set up so that I can start doing what I need to do on the next maneuver. And then relax. Good, we're going to do 1 more time. Start to cramp a little bit.
Yeah.
Good, 1 more time. 3, 2, 1, relax. Great. And then Lauren's going to come here. She's going to kick me right in the chest here. She's going to pull this leg up towards her chest. And then we're going to do this 3 times as hard as you can. Okay, we got 3, 2, 1, and relax. We're going to do that 2 more times. Go ahead and push down, pull up. 3, 2, 1, and relax. Good, and we're going to do this 1 more time. Push down, pull up. 3, 2, 1, and relax. Awesome. Good. So almost finished here. We're going to bring this leg up and over. Coming all the way over through this way. Good, there it is. Good, we're going to bring this leg up towards the ceiling. 3, and what did you feel on that, Lauren?
It felt so good. It was like releasing.
1 more time. 3, 2, 1, relax. And then we're gonna do this one more time here, coming up. 3, 2, 1, relax. We're just getting everything firing again,
Yeah.
waking everything up. It's just kind of been tight there and through the back, the hips. Same thing coming over. Good. We're gonna go just like that. Lift this leg up towards the ceiling. 3, 2, 1, relax. 2 more times. 3, 2, 1, relax. And then we're gonna do this one more time. Awesome. So Lauren's gonna come back here. Okay. Check the hips. Good. Start to look aligned. She's got one more thing she needs to do, so we're going to lay on the left-hand side. Her hip is still a little bit rotated higher than I would like to see it. So she's just going to go this position. You're going to push your knees down into my thigh here. Get that guy firing. So we're trying to work back here on the SI joint, the glutes. And then relax. We're going to do this one more time. 3, 2, 1, and relax. Okay, laying on her back. So Lauren's got a back and hip problem, not so much a knee problem. So we're trying to take the pressure off. She's going to bend the left knee here. She's going to lift this right leg up towards the ceiling. Actually, we tested you with the leg straight the first way. So lift this one here, hold it there, don't push it down. Same pressure as before, and she's strong. Okay,
Yeah, it feels a lot better.
Okay, so what we did is we did a pelvic reset. We got her low back here firing a little bit more. Took some pressure off the psoas here in the front. We got her hip flexor, the psoas muscle firing a little bit more here. Go ahead and hold it there again, Lauren. And still maintaining that strength. So now what you would see is, because the glute medius, the psoas, everything's working, I'm going to have Lauren stand back up again and squat, and you're going to see her, come down a nice straight line, hopefully, and not deviate towards the middle. So go ahead and stand, Lauren. Okay. So, and then what Lauren's going to do is squatting down 3 times here. We're trying to look at the knee, make sure it's nice in line here. She's going to put her rear end back a little bit, chest comes forward, a nice even squat. So go ahead and do that 3 times. Awesome. So really, really strong at the knee now. She's coming all the way down. That knee doesn't even wiggle or move. Looks really strong. So go ahead and have a seat, Lauren. Just kind of tell them a little bit how you felt when we were going over that.
Well, at first I felt very tight. Rob was able to show you that my muscles were just really not working the right way. So afterwards I felt really great after we worked on my back and my psoas. So, I felt a lot more comfortable doing those squats, and like my knees weren't going in as much.
Yeah, and that's just a little bit of a kind of a sneak peek of what we do. So basically this would be done at the beginning of the session for her. She would come in, we would make sure everything was aligned, everything looks great, and then, get everything firing. Now that's only kind of step 1. Step 2, she's got to get stronger. She's got to start recruiting more with those muscles to get that hip and that knee stabilized. So then that way when she's squatting, she plays soccer. So when she's cutting, when she's doing those deceleration activities where she stops and then goes to pivot, that knee has to be really strong, can't have any instability there at the knee, or else we're not going to talk about what she can do.
No, don't say it.
So what we're going to do here is give her a nice plan going forward. She's going to be able to get that hip a little bit stronger. She's going to go back to sports, no problem. We wish her the best coming out of Florence. So if you're a runner out there and need your knees looked at, I would start at your hip and lower back, and then possibly get in to do some physical therapy. So take care, guys. Until next time.